SNAP application assistance to more than 6,800 households. And an additional 2,100 households we've done pre-screening applications for. So through our work with consumers since 1986, as well as the past 6 years that we've been partnering with the department, we have firsthand knowledge of the obstacles and barriers that consumers often face. And to deepen our understanding of the frequency of the problems consumers and applicants face, we decided to take 2 different approaches. We collected data from consumers of the SNAP program through a survey about their experiences. And we organized test calls to the publicly available phone numbers, to DPW's Customer Service Center, as well as the local county assistance offices here in Allegheny County. And the results of these surveys and test calls illustrate that the department is failing in some very important areas and failing to provide consumers with basic service at a level that allows people to obtain and maintain their benefits. So we found some issues with paperwork. We found issues with contacting caseworkers. We found problems with reporting changes. We found problems with even visiting local offices. And we put all our findings in a report that I believe was passed out to all of you. It's a pretty lengthy report, but it definitely illustrates all of the data that we collected and our findings. And I'm sure there are probably some people here who themselves have had problems or know someone who has had problems, just like the ones that we're highlighting in our report today. So if there are others who have something that they want to share or have a comment that they want to share with the secretary, we would ask that you would put them on the note cards that we provided in the back room. I have some note cards here, but if you don't have a question or a comment now, and at some point you get one, and you don't have a note card, just raise your hand and one of us will make sure that you get one, and I'll be sure to read that at the point when we get to that point in our agenda. So we'll try to get to as many of them as we can. If we don't get to them all, we'll make sure that the secretary has copies of them and she can address them in her own way. So we've invited some clients here who have some personal stories and testimony that they want to share with the secretary. But before we allow them to do that, I just wanted to formally introduce the secretary to you. I stole some of this from your bio, but whenever I'm finished, you feel free to share whatever you want to share, add to it, or whatever, however you want to address us for a few moments. I will give you that opportunity. Professionally, Secretary McGrath has spent a significant amount of her career working with and advocating for abused and neglected children, as well as domestic violence as well. In 2000, she was elected to the Pennsylvania House of Representatives and served 4 terms in office. In 2008, she assumed the position of Executive Director of the York County Human Services Department. In November of 2011, she was first appointed by Governor Corbett as the Deputy Secretary of the Office of Children, Youth, and Families in the Pennsylvania Department of Public Welfare. And then in June 2013, she was formally named as Secretary for the Department of Public Welfare. Personally, she is the mother of 4 and lives with her husband, Michael, in Spring Grove. And lastly, I would just like to say that we recognize that you have only been with the department as Secretary for a short period of time, and a lot of these issues and concerns that we're raising today predate you. So this is not an attack on you. It is issues that we've been talking about for a long, long time, and we're hoping that you will sincerely listen to our concerns and seriously, take our recommendations. So with that, I will turn it over to you to share whatever you would like.
Thank you so much. And first, I just want to say I am thrilled to be here today. I said to Heather, this is Heather Hallman, and she's one of my special advisors. So actually, she helps me with just about everything. And she will be available also if there's questions that I don't know the answers to. She will, because Heather actually is assigned to the department that oversees the county assistance offices. She helps them. She's just there as the liaison with the secretary's office, and that's a relatively new thing. As you heard, I'm relatively new to the position of secretary since June. I was a deputy before that for about a year and a half, but DPW is huge. We have about 17,000 employees. We have a budget of $28.4 billion, the entire size of the Commonwealth budget. Much of that money, much of the state dollars we use because it connects with the federal dollars and helps us to draw down federal dollars. So much of what we do is based on federal requirement and certainly based on state law as well. We do everything in the department from early childhood learning to child abuse, mental health, drug and alcohol, services for people with disabilities, and aging. We also have another component, that's mostly our human services component. We also have another component of DPW that really, it's healthcare. It's medical assistance, it's nursing homes, and as you all know, it's the services that we make available to individuals with lower income, or again, who have a disability or senior population. So it's a huge department whose responsibilities span the lifespan of people. So it's a pretty enormous task to be the secretary. I've had meetings like this. I continue to go around and meet with groups because we do need to do better, and we know we need to do better. So I'm not coming in here and saying we're doing everything great. A lot of the realities are that for some of the things that we want to do, we don't have the dollars to do it. It sounds like we should have lots of dollars, right? But all those dollars have to go to services. And so when it comes to things like, we're looking at phone system stuff, and as I was looking on the walls, and I'll be happy to answer the more specific things, but they're very costly changes. Some of these I see on the wall absolutely are not costly changes, and they're things that we should do all the time. As you know, what happens in any state government department, as different governors come in and out and different administrations, they bring new people in. And honest to gosh, that's all part of the problem, because you just get to a point where you know what's going on, you're working towards solutions, and then we turn over again, and then you have new people again, and don't you feel like you just start all over again? I mean, probably this is not the first meeting you've had to talk about these issues, because these issues have been there historically. And that's really the sad part about the way it works, because you end up spinning your wheels as opposed to really moving to the next step. Within DPW, because it's so big and we have so much that we have to deal with, we have focused really on 3 priority areas, and I just want to mention them to you so you know what they are. It's part of our strategic planning. Number 1 is back to basics. We have asked all of our deputies to go back and look at, what are we doing? Is everything that we ask people to do the right thing? Or have we just layered upon layer forms, and is there an easier way and a better way to do our business? So we are re-looking at all programs, we are re-looking at decisions, and we are re-looking at what we're asking of others. When I was at the Deputy Secretary for the Office of Children, Youth, and Families, one day they brought me these papers to look at, and I looked at one and I said, well, what do you do with this? Oh, nothing. I said, well, why do you do it? Why do you have the county fill it out? Well, because we always have. And you get to that. And so we're trying to get away from that and to really take a look at, how do we do a better job? How can we become more efficient? How can we streamline processes? And I think all of you are sitting there going, yep, I can tell her about a situation where you have to do things several different times and write the same thing over and over, and you're feeling like it's just not acceptable. So back to basics is one. Another piece is communication. Meetings like this, and we're going to make part of what we do every day. And you should invite our Deputy Secretary of the Office of Income Maintenance to come here and speak to you as well. Because we now, as our mission moving forward, it's about communications internally and externally. As I looked at the wall, I thought, okay, my caseworker was rude to me and raised her voice to me. That should never happen, ever. We're public servants. We work for the people of Pennsylvania. So if that's happening, we're sharing that message that we are public servants and we expect people to act that way. And what does that really mean? We're trying to get that message down to 17,000 employees in a large state. It's hard. It's hard, but that's important for us, and we can talk more about that. And the last one is accountability. And accountability goes to two things. One, it goes to the people that we serve, because we want to ensure that the people we are serving are getting what they're supposed to have. We also want to ensure that we are good stewards of the tax dollars. So that's our responsibility. And if people are not getting food stamps when they're entitled to food stamps, that's a problem. If people are not getting health care benefits when they're entitled to health care benefits, that's a problem. But if we're just throwing things at people, which we do with services, we have services that we've provided to people that are not improving their quality of life. That's a problem. So it's really striking that balance and making sure we do this right. So again, that's just a very brief introduction. I'm here, let's make this a conversation. Can we do that?
Yeah.
Ask questions, let's talk. I am happy to do that. I don't know if it would be okay to find out, I'm at the group here, but could people just go around real quick, or do you not have time for that? What would your thoughts be? I'd like to know who's here, who I'm talking to. Somebody's shaking their head, we don't have time for that, right?
We want to make sure that we get the meat of the, get to the meat of why we actually
Okay,
here. So,
all right, then that's okay.
So if we could, stick to that, and then if we have time, then folks, if they have comments, then they can introduce who they are and where they're from.
Okay, that's fine. Thank you.
So thank you for sharing. I just wanted to acknowledge if there are any policymakers, legislators, or staff members here. We would just ask that you would introduce who you are and who you're representing.
How you doing, Secretary? My name is Kyle Stewart, and I'm from State Representative Jake Wheatley's office.
They want you to stand because they can't see you.
Hello, everyone. How's everyone doing? My name is Kyle Stewart. I'm from State Representative Jake Wheatley's office. I'm really here to gather some information. It's a pleasure to be here, and I thank Rochelle for inviting us, and look forward to some of the information today.
Thanks for coming.
Absolutely.
So now we'll hear from some of our consumers, and I'm going to sit down and let them take the show over. And they're all prepared, so bye-bye.
Last year, I had called to see if I had gotten my food stamps, the paperwork was taken care of. This lady must have got up the wrong side of the bed. She was so rude. And I explained to her what I needed. She says, no, it's not here, that's your problem, not mine, and hung up. The next day I had called, I had talked to this gentleman from another different county. He was so nice, he took all my information, and here he put his supervisor on the phone. And she took all my information, there was nothing there, and I had mailed all my paperwork in a month earlier. And they should have had it. So she took everything I needed, and then once I finally got my paperwork, again, I called to make sure, and then I got my food stamps. They were a little late, but the next month, they made it, they made up for it. And then the supervisor had called me within a week to make sure everything was updated.
So here we're talking about a staff person who, and you're always gonna have it with any staff, you'll always have good staff and not so good staff.
Right.
And there is a process to address that. And it sounds like the supervisor absolutely did his job, right?
She was very nice about it.
She was, okay, so I would recommend that if you're ever confronted with that, it's not acceptable behavior for any worker. And so you should go to the supervisor, which sounds like what happened. And it was taken care of, which is good.
She didn't give me a chance to say anything. She just clicked on me real fast.
Well, that's not acceptable behavior.
I mean, you have to push this button, that button to get somebody, and you never know what county you're going to get or who you're going to get. Thank you so much.
Thank you.
Good morning, my name is Jude. I work down in Lawrenceville. I cook. Now, among some other serious conditions, I am a type 1 diabetic. And before I lived in Allegheny County, I lived in Indiana County. I had benefits there. Upon moving here, I wanted to have my benefits renewed and forwarded over. And I got in contact with a good friend of mine who then pointed me towards Just Harvest. And Just Harvest started helping me fill out my paperwork, and they would fax everything, email the necessary people to let them know that my paperwork had gotten in. And I experienced a severe lack of correspondence. Even now, after my case was severely mishandled, I am not getting calls from my caseworker. I had a drawn-out denial, and because of that severe stress and the lack of insurance, I ran out of diabetic supplies, and I ended up in the hospital. So, after that, eventually I got benefits, and really, I couldn't have done it without Just Harvest. I sincerely, moving here, I sincerely felt that if Aubrey hadn't been there, and if Just Harvest had not been there, no one would have cared if I would have lived or died. And that is I'm serious about this feeling. I think about single parents, I think about other students, I think about elderly individuals, you know, trying to get this taken care of. And it's been increasingly difficult, even with the help of Just Harvest. And I'm a competent individual. Currently, I've been denied medical because I make too much money. I make $9 an hour working in a restaurant. And while I am making $9 an hour and I'm able to scrape by on my bills, that doesn't take away the fact that I have diabetes. And I mean, the Department of Public Welfare, they dropped me, and they did not tell me where I should turn next. They didn't offer any solution for me, any sort of, well, hey Jude, you should maybe check this out next. So I found out I no longer have insurance again. Luckily, I went through a lot of trouble before, and I have Just Harvest, so I have felt safe enough. But I guess with me talking, I'm asking that we find a way to adequately get the right people into the DPW, to pay our social workers, get enough social workers that they can do their job and do it right. And having more organization in this so that we can get things done. Because I mean, I'm one citizen and I'm one case. So, thank you.
Thank you. And a couple things I'd like to mention that could be helpful to you is, number one, part of our problem has been, let's start at the beginning. We're not sure that the test, they're all civil service employees. And we're not sure, in fact, we're pretty sure that the test does not get us to the caliber of person or the people that we want. So that's number one. There's a new civil service commissioner, and I met with him last week. He just got on the job, and I was probably the first call to him to say, we need to talk about this. We don't believe this test gets us to the people that we want. So that's really number one, because if you're taking a test, you're getting on a list, and then the people on the list aren't the right people. That's a problem. Number two, pay. The pay's good. It's a good job, and it's a relatively high-paid job everywhere. So that I don't see as the issue, because they're state employees, and again, their pay is good. We have had a problem with turnover. However, we're doing very well with this right now. We saw numbers yesterday as we were walking out the door, and our vacancies are down significantly. We put on what was called we're not allowing people, I know in Philadelphia, and I don't know if we're doing the same now in Dayton, but to transfer, because we were having such high rates of transfer. People would take a job, on civil service it's a statewide list, so if you lived in York where I live. If you live in York County, you could say, wow, I really want this job, so I'll take a job in Allegheny County, get an apartment out here for a couple weeks until you get your foot in the door, wait for an opening and move. And a lot of people don't want to stay, so we've had to put a stop to that. We recognized that we were losing good people when they did that. So we're working on that. Well, we've already changed it, but we're really watching to see whether that continues to be an issue. Lastly, we have a new person who's now in charge of the CAO offices. His name is Tom Strickler. He is excellent. This is a huge job. He cannot turn things around overnight, but he is very, very good. And he is visiting the CAOs, as we are visiting the CAOs as well, and listening to the staff, talking to everybody, talking to communities, just like we're doing here, and really trying to find out what are the issues so that they can be addressed. So we've already made some steps to move in the right direction. We could put all the workers we want in and hire, but if they're not the right ones, it's not going to make a difference. And behaviors such as the woman before you mentioned, that's just not acceptable. Doesn't matter if I have more workers, if anybody's going to treat another person like that, not acceptable behavior.
I think another thing is, as we've gone around and talked to different CAOs, they do want to help. I mean, the staff really do care. Do they have bad days? Absolutely. But a lot of, they really do care. And the one thing that we've found is that they don't always know all of the services available in their community because they haven't necessarily been given that opportunity to learn about that. So we're really trying to look at that. How can we help them to help other people to make sure that they know what's available in their community? That's not just another government service, but also something that's going to be able to help those individuals, those supports that you really need.
Well, it sounds like your plan at this point is a very proactive approach.
Yes.
And in my experience, proactive approaches probably work out in the end. So
Yeah, we are really trying to turn the system so that we become proactive versus just reactive. Reactive is a Band-Aid. We stick a Band-Aid on it and then we try to move forward. Never does it solve the problem. So we are trying, by doing these kinds of meetings, to get the information, take it back, and really work. We've asked every bureau to prioritize what are the issues we need to address first, because when we focus on everything, we do nothing. So we're helping them, we're meeting with them, our senior staff, every bureau, they're doing their own plan, they're laying out what needs to happen first, second, third, and we're trying to get those things accomplished. Otherwise, we're gonna be back where we are today. We'll never get off the mark if we don't start, and that's what we're doing. I would encourage you all to invite Tom to come to meet with you. He really is out there trying, he's meeting with people, he's listening, he's got great ideas, he's already made some significant changes in the way we do things. Fresh eyes. He's not from the system, so he came in with these fresh eyes, looking at it and saying, why do you do that? Why do you do that? Let's do it a little bit differently. He's gonna make mistakes, we all do. But he's willing to try and think outside the box so we do a better job.
thank you.
Hi, my name is Linda Davis, and I've now been a widow for almost 10 years. I went to call customer service. I had problems trying to get my EBT card renewed. The form letter came. That was confusing. Because when I read, the first thing I saw was the day that I was supposed to have my telephone interview. I didn't get that, so I called there was an 800 number I could call. And apparently I hadn't sent the paperwork in that they needed, but when I talked to them, they were more confusing to me. I finally had to call Just Harvest to get the process working. And if it wasn't for being with Just Harvest, I would still not probably have my money on my card. But I also had problems with, the time and the day of the interview on the sheet that I got was not good, because I didn't have enough time to get copies of things to send. There was such a short amount of time to send the copies, I couldn't get it done as I should have. And, like I said, I had to call Just Harvest and talk to a member here to get it worked out. Even then, there was still a problem. So I had to call Just Harvest again. I don't think I should have had to make so many phone calls just to resolve and get the money in my EBT card. And that was the problems that I've had with dealing with the food stamps.
That's really about efficiencies. And remember, part of our focus, one of the 3 areas is back to basics. Our focus is about ensuring that if you are an accountability to the consumer, our focus is really about being more efficient and doing things in a better manner. So again, as part of the procedural things that that Tom is spearheading looking at, is making sure, looking at time-consuming processes. What are our expectations? Another thing that we've learned over the last few months is that we have a Compass. Has anybody in here used Compass? Okay. Compass, have you used it recently? Because it's kind of even more newer and improved. If you haven't, Compass is a way to go into the computer if you have access. And Just Harvest, you have computers people use. So you're able to go in and put in all your information, and you should be able to know what your benefits are. It populates different things, so you don't have as much. We're trying to make it even better. Replication, duplication of effort, and we're going to continue to do better. But every CAO office that we've been traveling to, we've never seen anybody using Compass. They're in there, they don't use them. And our staff that's an easier way to do it. It's a more efficient way, it's better for you all, it's better for us, and we can process things much quicker. We are working at upgrading our systems as well. It's expensive, and so, we've been trying to get it done and trying to get it done. Finally, we're moving in that direction to get that done. When our systems are updated, we should have some real-time information, which should change the entire process that we're now using. So that's our hope. And it should take out some of the human error that occurs.
Also with, just a recent upgrade that we had, there's a lot of federal data sources that we're now able to pull, which has also improved our ability to, then we don't have to ask for so many papers. And also if you use Compass, you can scan the papers, you can scan your documents in, which also helps with that smoothing documents and everything.
Question, what do you do when you don't have a computer available?
You come to Just Harvest, or places like this, or libraries. We know that not everybody does. And we know that there will always be people that will need to either come into the CAO offices or to do other things. But for those that do, or those that are connected to agencies and organizations, right, your state reps offices, they can do it for you. It is really important. Think about it, if you have 50,000 people who need benefits, if all of those people go to the CAO offices, there could be, it's craziness. But if even half of those are able to do it online through the Compass application, that cuts down significantly on the amount of people and the amount of papers that can get lost. So again, using your state reps offices, I think is a good idea. Just Harvest is a good idea. Libraries all have computers. And again, we're doing everything we can to figure out new ways to help people to access.
Thank you.
You're welcome.
Yes, hi, I'm from Brian Durham, and, they need to update their phone, because I kept getting drop calls. When I got somebody, they were very rude, service training or get better people in it?
When was it not called?
Numerous ones.
Yeah, but has it been recently, like in the
No,
last 6, 8 months? or
I'm
before
talking
that?
about 2 months ago.
2 months ago.
Yeah. Repeated calls were dropped.
Okay, we do have a new phone system. It doesn't always work the way we had hoped it would. So we've been struggling with it, we're trying to get it up to speed. So let me tell you something that happened. Philadelphia couldn't get through at all, so we shifted some people to handle Philadelphia calls, and the rest of the state had to drop calls. So now we're trying to figure out how do we do it so the entire state gets the same response. And again, we're looking at new ways of doing business so that we have people specifically trained to do like LIHEAP, and people that will handle a call center that's what they do. So we're really looking at what is the volume, and actually we're using our data to help drive decisions. So where are we having the problems? How do we use the data to tell us how many drop calls, from what areas, and can others pick up? You have some rural areas in Pennsylvania that don't have this problem. So can we then use them as backups for a Pittsburgh or Philadelphia area? And that's the kind of thing we're looking at.
Well, if I can interject something else into that.
Absolutely.
Just Harvest has been a blessing for me because it's like a buffer between us and the social services.
Yeah.
So I thank God for Just Harvest because they're like an attack dog for me.
That's a good thing. It's a good thing. That's what you're here to do. Thank you. Yes.
My name's Tammy. I want to thank
Hi,
you for
Tammy.
the opportunity to speak to you today. I'm a 27-year-old resident of Allegheny County. I've received roughly for the last 2 years EBT assistance through the Southeast District Office. I'm here today to ask for you to help improve customer service so what happened to me will not happen to others. When I initially found my application for assistance, I did it through Just Harvest. I received a phone call within hours of my application. The woman was polite and informed me I could pick up my new EBT card that day and an allotment would be placed on the card for use the next day, and it was. This left me feeling as though the lines of communication were open. I could never have imagined I'd be where I am now. From that initial call, I have only spoken to a DPW caseworker 2 times. Both were initiated by me via the statewide change center. The only conversation I had with my caseworker was prompted by me because they did not call in their scheduled time frame for my phone interview. In this instance, my semi-annual review. When I did receive a call back, I was informed, we don't normally call for the interviews unless we need more information from you. This led me to believe as the months went by, when nothing changed, nothing was supposed to. Then in April of 2012, I started a second job. Once I received my first pay, I notified DPW by dropping off my first pay stub in the drop box. My annual review in September of 2012, I received the packet, filled it out to the best of my ability, copied my pay stubs, and again dropped it in the drop box and filled in my own receipt on September 27th. When I received my renewal statement and my EBT benefit didn't change and benefits were re-renewed, I knew DPW had received my packet, therefore they had received my pay stubs. Then in mid-April of 2013, my benefit lowered from $200 a month to $65 a month. Not knowing what was going on, I called the 1877 number and waited for over an hour to reach someone. I asked what was going on and was informed there had been an income change, to which I responded, that can't be right, I've had the same full-time job since last year. She told me the income change is what lowered the allotment. I asked if I could speak to my caseworker. She told me I had no reason to and gave me a ticket number, and I never heard from anyone after that until mid-September of 2013. When I was notified I needed to speak with the Office of the Inspector General regarding an $1,800 overpayment. With Just Harvest help, I have been able to appeal to DPW to review this as I don't believe it to be completely correct. Today I'm here to ask you personally what you can do to ensure that this does not happen to others. This overpayment hangs over my head. I have no way to pay it, and I believe I have outlined at least 2 instances or this error would have been caught, and I wouldn't be here asking for your help today for myself and others.
So I think what you're saying is they gave you the wrong benefits, even though you did everything right,
Right.
they interpreted it
I
incorrectly.
filled out all my renewal packets.
Right,
I
and now
sent in
they're
the pay
all-
stubs, doing 3 reviews every 6 months for 2 years. Never had a change. They never calculated my income. They never even considered.
What I'd
the
like
pay
to
stubs.
do is, why don't we take your name, I'd like to look at your case, pull it, have it reviewed, and see what's going on. Can we do that?
I just wanna highlight there that, I don't know if you caught her story, but had they had, in terms of customer service,
Had they had called me for.
done
Right, and they
the
called
phone
you, I got
interview the
that.
way they were supposed to,
I
they
don't
would
wanna-
have
Had
clarified
they
some
have-
of those things up front.
Had they have ever called me during my review, when you get a packet in the mail, it has a date and time that they're supposed to call you. And after the first time, I had called them and was informed that if they didn't need anything, they would not call. So I basically disregarded that paper with a date and time for the rest of my reviews because nobody ever called. I have been 2 years, I've never even met my caseworker, and I'm not really sure of his name, to be honest.
We see a lot of that in
Nice.
our office too, like they'll come in, there'll be a bunch of overpayments, and I think it's trying to find out, right to your issue of accountability, and who's making the mistake there, and then how can you address it, because, you're going through something that no one would wish on anyone else,
Yeah.
and then you try to, work liaisons up at DPW and try to figure out what happened here, what happened there. But at the end of the day, sometimes we can get positive, results, and other times it's more challenging, drag on, and that overpayment needs to be paid, but at the same time, where's the accountability? And that's where it's just hard to say to a constituent or to a consumer, it's like, oh, sorry. And then, it's just, that's the challenge too, I think, a lot of what we see, and we do our best to help, and the liaisons are really good up in Harrisburg to help us with a lot of stuff, but at the end of the day, it just goes right to one of your focus areas, and that's where we, sitting here, we can appreciate you at least trying to address that, and hopefully.
Absolutely, absolutely. I'm gonna get all your information, so we can have that reference pulled and totally reviewed and see what happened, okay? Thank you.
And that's great, but I wanna make sure that we highlight the systemic problem here in that, and this happens, we see this all the time, where people are sent notices that says, we have you scheduled for a phone interview
Yeah.
on November 5th between the hours of 9 and 12, and they don't
And they
call.
never happen.
And the applicant or the consumer is waiting for the call, and they never get it, and then the mistake's made later on down the line, but in the system it says the consumer was a no-show, when that's not what happened, that they never called the consumer. But on the caseworker's end, we can't control what gets put in the computer, and generally, I've been doing this long enough to know that generally the accountability thing gets put on the consumer and not the actual caseworker. So that's definitely something that needs to be looked at, some sort of accountability. If you schedule a
agree.
phone interview,
You better make the phone
Absolutely.
interview. Yeah.
even if you don't need any, there's nothing else you need from them, at least call and say, well, I have everything else I need, I have everything I need, we don't need you, but you can't have somebody sitting for 3 hours and not call. And then
10 minutes would have solved this problem
And
a
then a
year ago.
mistake is made, a year down the line.
Madam Secretary, also while you're looking, can you please check on to see why we have so many parents, mothers that have children, reinstate for their food stamps, and they're going 2 and 3 months without receiving anything, can't reach their workers. Can you check on to see what that lag is going on between their kids?
Do you have, it helps if we look at things from a more general perspective, it's harder to find. We found that, we're looking at some other issues that have come up recently, and as we go through our system, we're not finding what's said. Do you, if you have specific names,
I am the name.
oh, that would be terrific.
And I'll make sure
Okay.
you get them.
Thank you, because that would really help, because we actually pull that, and then we can actually see what's going on. But as we look at it from a bigger perspective, we're having trouble doing it. Okay, thank you.
Hi, I'm personally one of those cases of one of those names. I have worked every single day of my life since I was 16 years old, and it was more humbling and hard for me to even ask for help. I've exhausted all my retirement, all my savings, because I didn't want to ask for help. So on September 16th, I did the Compass system. I scanned my stuff in. I did everything I was supposed to do. I'm still doing it. My child is ill, that's why I had to stop working, my middle child. He has not had medication for a month now. I was told by Mr. Cooper in the Allegheny County office, will join the crowd, everybody has urgencies, and hung up on me. I then had called and spoke to a supervisor who was Mr. Edwards, who then said, you know what, you're right, we will get this taken care of. That was on September 27th. I got a letter October 16th that my children are denied because they didn't receive paperwork. Yet I have all my fax receipts, my scan receipts, and everything else. And then when I called to find out why, I'm on my 37th call without a return call. And if you don't get a return call, they answer and says you've reached the department, and I'm sorry, we can't come to the phone right now, please call back later. It's an automated system, nobody even picks up. I finally get in touch with the person that the supervisor signed, and he said, well, I'm not the one that signed that letter. It was a caseworker who shouldn't have done it. There's nothing I can tell you, appeal it. I said, so my son's gonna go another month without medication, without his glasses, and my son has a negative 975, which is 0.25 points away from being legally blind. I have worked every single day. I have gone to work 10 days after I had to apply, back to part-time, and had to sacrifice my children. My mother's almost 70 years old. She is trying to help me out. I was then told they needed to see my tax returns, an affidavit from my mother, my mortgage payments, why I filed chapter 13.
For health care for your
Yes,
child?
yes, I had to file chapter 13 to save my home. I had to send those papers into them to let them know. And I asked them, why are you guys interrogating me instead of interviewing me? I don't have a sense of entitlement. I just want my children to be taken care of for a very small time.
We need all of your information.
So yeah, my children will not get any food benefits this month, and yet they will not have health care. I've had to cancel my child's 12-year checkup. And I understand, I think what the problem is in the office, it's not the civil service test. It's that they profile everybody as being uneducated, I don't believe that this system is put into place as a lifestyle. It's a stepping stone to help people get on their feet.
It's a safety net.
Right, but you're
And
not
it's
treated that way.
supposed to be there to help you.
I'm
You're right.
38 years old, I've worked every day since I was 16 years old.
I need all of your
I
information.
have it all right here. I have everybody's name that I've spoken to. How I was told everybody has urgencies, join the crowd. I guess your kid's just like everybody else, and hung up on me. I was
Well-
asked what I did with all my retirement money that I took in 2011.
When it comes to healthcare issues, there is no reason why your children should not have healthcare.
Well, my children do not, and I paid for them to have it since the day they were born. And, you know, like I was said, well, how many kids do you have? How many different people? First off, I've been with the same man since I was 16 years old.
They asked you that.
Yes, all three of my children have the same father. I am educated, I've gone to school, I've gone to college.
And it doesn't matter.
It doesn't
Everybody
matter.
deserves to be treated with
Right.
respect. And you have the names?
Yes, I do. I
Can you
have their
get copies of
signatures.
her papers?
And then I was told when I just spoke to somebody a few days ago who accidentally picked up my call, she said, well, they didn't document anything, I don't know what to tell you. And also, I called again this morning at 8:24 to try to get some resolve because, like I said, my children need to eat. I had to cancel my son's 12-year checkup. My son's glasses need to be checked. But I'm gonna have to have my mother help me with the money that I'm making, figure out a way. My son's medicine's $600 a month that I've been paying out of my pocket. I can't do it anymore, otherwise I would have never asked for help. There's people that I feel would need it more than me, that's why I took my retirement, spent my savings.
We have to pull your file and look at everything. We'll do that right away. Thank you.
This has been a very, very difficult process for my
I
daughter.
mean, my dad has had a liver transplant, he's not getting his medicine so they can help my kids.
I mean, she has a child with asthma.
No asthma meds.
No, my son has Lyme's disease severely, had to go to the Children's Institute for over a month, has been in a cast and in a boot for over a year. I can't take him to the doctors because it's infected his bones. He hasn't been to the doctors. I can't take my son to his 12-year checkup. My pediatrician's not gonna treat me for free.
So have you applied for medical assistance for your children?
Yes, on September 16th.
And so you still have not heard anything?
I was denied.
You were denied?
Because
And
they said they don't have my paperwork yet. I have every receipt of them
we need that. We should follow up right now. We need that right away, okay?
And as heart-wrenching as this is,
It
this
is
is not
heart-wrenching.
individual, this is systemic. There are many, many people just like her who have the same scenario, sometimes even worse, as bad as hers is. And so that is why we invited you here today. And everyone here has illustrated issues with communication.
Yes.
There are huge problems with communication, communicating with the CAO. In our own report, we illustrated that when calling the local office, 82% of survey participants reported that they experienced disconnections or poor voicemails. 43% stated they were more likely to be disconnected than able to talk to an actual person. Phone calls get dropped. You're on the line for 40 minutes and it just drops you. Doesn't give you an opportunity to leave your name and number, it just drops you. And you have to start that process all over again. People spend weeks and weeks trying to get through, to do things, to resolve an issue such as this. My kids are hungry, my kids need their medicine, I need to take my kids to the doctor. So we're not talking about people who, are just sitting around with nothing else to do. We're talking about life and death situations most of the time, a lot of the time. So these are huge problems.
I work.
Right. Absolutely. So with that, I'm gonna just try to read real quick a few. Are we on time? We're good? So we got a few statements from some folks that couldn't be here with us today. This is from the Community Social Services Coordinator at UPMC Yuki School. So she says, "Dear Mrs. McGrath, I'm sorry I am unable to attend this meeting, but I wanted to express my viewpoint through this letter. I'm a Community Social Services Coordinator employed by UPMC in the Keysport and contracted by HUD Housing Sites. I have a caseload of over 300 residents. I have been doing this for over 12 years. Almost all of my residents are on food stamps and many are on medical assistance. In the last 2 years, trying to communicate with DPW has been growing more and more difficult, and in the last year, virtually impossible. Instead of one case manager handling all aspects of a client's case, we now have 2, 3, or more. Almost no one answers their phone or returns a voicemail message. Those who do are treasured. Their answers are knowledgeable and concise. Up until about 1 year ago, I could call DPW's communications phone line in order to obtain the name of the client's case manager. Now it appears that that also has changed, and there's no one answering that line either. I'm asking that the Department of Welfare have a number to call or an email address for professional people like myself who are trying to make life easier for your case managers as well as the clients that they serve. I know that the caseloads have increased dramatically, but people like myself who are out in the community need to be able to get answers so that the clients know that they need to know what they need to do to comply. If I may be of any assistance, please call me or email me at the number listed below, and I'll make sure you get a copy of this.
Thank you.
This is from an executive ally, community engagement, she's community engagement coordinator at YouthWorks. Dear Secretary McGrath, nearly 7 months ago, I began the process of applying for SNAP benefits. This week, I will finally begin receiving the benefits that I am eligible for. In April of 2013, I applied for SNAP benefits through the online compass system. I have been an AmeriCorps Public Allies member since December of 2012, and though I was eligible then, I wanted to try to get by on my own with $1,400 monthly stipend without asking for help. I'm very thrifty and have kept a tight budget my whole life, so I was confident that I could make it on my own. When money started getting a little too tight for comfort, I decided that it was time to apply for food stamps. I indicated my AmeriCorps stipend amount in my application, assuming that the caseworker reviewing my application would know not to process that as income. After submitting my application, I completed my phone interview, at which point I made clear to my caseworker, whose name I never knew, that my only income was an AmeriCorps stipend. The caseworker acknowledged and thanked me for my public service, designated my stipend as income anyway, and a week later I found out that I was approved for only $16 for food stamps. I asked my AmeriCorps site director for a signed letter explaining the situation, citing the legal precedent for AmeriCorps stipends not being counted as income for SNAP purposes. And I both faxed and mailed a hard copy of the letter to the department, the Greater Pittsburgh East Office. My fax and hard copy of the letter, which included my social security number, date of birth, full name, as per the documentation requirements, DPW seemingly disappeared into the system, and no one at DPW ever received these documents or did anything with them. So I hope they are safe, or they are in a safe place, wherever they end up. I also called the office and emailed the helpline many times. As someone who works with at-risk youth, out of the foster care system, and someone pursuing SNAP benefits myself, I have called the DPW Greater Pittsburgh office dozens of times in the past 6 months, and not once have I gotten through to a person. The on-hold music plays for minutes until the caller is directed by an automated voice to call back at another time because there are currently too many callers. There is no way to leave a message. For someone like me who works 9 to 5 every weekday, it is extremely difficult to spend hours a week trying to sneak through the DPW phone system at just the right time to speak to a person during regular business hours. Dealing with this process on my own became disheartening after a while, and eventually I gave up. It's easier to live in poverty without help than to try over and over again without success to prove that you are poor enough to deserve it. Gathering all of the documents necessary to verify that I didn't have too much money or income, and almost certainly overburdened casework. Money or income was difficult enough without the extra trial of trying in vain to remedy the mistakes of an insufficiently trained social worker. And I can't imagine the frustration of, wait a minute, almost certainly overburdened caseworker. I'm 23 with a college degree and plenty of experience working with social service providers, and I can't imagine his frustration and hopelessness that someone who's 18 with no experience communicating professionally would have with this process. To successfully navigate the current process, you need to know someone in the industry who can help you through it, which means that the people most in need of benefits are often the people least able to access them. Thank you for taking the initiative to examine the system in its current form and find ways to make it more effective for the most vulnerable among us. And I'll make sure you get copies of those as well.
Can I say something?
You wanna hold that thought? Okay. So let's see. So I have a question here. Someone wants to know, how can clients find out who their caseworker is? Because they often don't get that information or lose it. And of course, you can't get through anybody on the phone. So, people often don't know who the
I'm the one that submitted that question, and I work with 110 seniors and disabled individuals that had subsidized.
Okay.
And I don't know the answer to that at this moment. We will work together. Do you know?
There were some changes made to the notification forms that go out, so everything is very processed. And we have 2.8 million people that we have in the system, so everything's very automated. And so some changes were made to those notifications. I don't know exactly when it was, but we are looking at changing those notifications back so that they do have the caseworker's name and telephone number on them. Because we've had to make such huge changes currently to our system due to the Affordable Care Act, it's taken a back burner because we've had to get up and running by October 1st, and you see what happens if you don't prioritize that. So we're looking at that. It is going to be something that we do. It's not going to be a quick fix because it does take quite a while. We can only do I'm becoming an IT expert at this point. We can only do upgrades at certain times and rewrite things, so it will take time. But we are looking at it now.
That's great.
Yep.
Okay, so this is about, it says, when helping clients with renewals, they always include info and voting. I'm assuming what their name is that they always put in either a voter or yes you vote. So the question here is, that should be reworked, and it should just ask, are you registered to vote, instead of every time we renew it, they ask you the same question over and over. I don't know whose question that was.
That was mine
Okay.
too.
That's federal. It's a federal requirement.
But I always write in when I'm doing the renewal, already registered. It doesn't give you that option to put that. It's, you want to get registered, but you just want to write, I'm already registered. All you want to say is,
Yeah. Are those parts federal?
I think that
It's a
way
state
that it's
mandate in
written-
response to the,
It's
Right,
written in a
right.
very legalized way due to the requirements. So unfortunately, there's not a lot we can do around that.
Yeah.
Yeah, it's all federal, and we've said the same thing. It's really horrible. We have to, if we go out for an investigation of child abuse, we're supposed to ask them about voting or give them a card. That is really ridiculous.
I
think the bigger issue there is that for those who aren't registered to vote, is send the information
right.
back that DPW actually.
Nothing happens.
Nothing,
Nothing
that's the
happens
bigger
anyway,
issue.
don't worry about it, right, just write down, not already registered, and send it.
That's what I do.
Check the box, yes, they want.
They want to register to vote.
Yeah, then nothing happens.
Yeah, that's the bigger issue.
Nothing happens when you check the
No,
box?
nothing
Nothing
happens.
happens.
Nothing
It's a
happens.
violation of the National Voter Registration.
Right, so we have to do, but we.
We've done some work in the
Leave it.
past with DPW, we're trying to get them in compliance with actually doing something with those folks who actually do want to register to vote, but we're not quite there yet.
Okay.
We need to, that's
Because there's no reciprocity between the DMV, I mean, not the DMV, the State Department, records and your records,
yeah.
is why. You can't just send it in.
Got it.
Okay, this is from Vicki Stevenson, she put her name on here, so she wants to know, about lost documents and being cut off when she was up for reauthorization. Now she's stuck with debt, and I don't know if you wanna take 1 minute to just expound a little bit on that?
Okay, what happened was, I had a pre-existing medical condition, and I was in the middle of treatment. And I was up for reauth, I sent my paperwork in, and somewhere between, I supposedly had till like July to be cut off. And I sent my paperwork in several times, it disappeared, I was going through treatment, and they cut it off in the beginning of June, and it wasn't supposed to end till like the end of, till the beginning of July. So in the midst of all that, I had seen the different doctors, got my treatment, and now I'm hit with all the doctor appointments, all the stuff for the treatments, all the imaging appointments. And I called somebody and I said, well, look, my income didn't change. I wasn't working because I was sick and I lost my job. But the doctor doesn't know that, okay? And the imaging place doesn't know that, and all the treatment stuff doesn't know that. So I haven't had, and this was like last year, they'll say, oh, well, it's been too long, we can't go back and fix it. I'm like, my credit rating is so low.
We're re-evaluating all of our, and we're relooking at every single one of our programs. So it's not just the asset test, but I think we would be remiss if we did not relook at everything that we're doing to ensure that we make good decisions, it still matters, and we're doing it right. So part of what we're doing is pulling all the data about timeliness, how many people, so all the things that'll tell us, did we do the right thing, did we not? And I want you to know that we're doing that with everything.
Well, the asset test was a personal thorn in our side, so we are really glad that you're looking at possibly taking that thorn out.
Yeah.
And we'd be happy to sit down in another setting to talk about reasons why we feel the asset test.
And I would certainly.
How long do you think it might take?
Well, it's all part of, remember, we began with our three focus areas. It's all part of that piece. Right now, we are working diligently on, you would think with 17,000 staff, we have plenty of people, but most of those staff are out in the CAO offices or in some of our institutional settings. So what we have in our Harrisburg main office, that there's a core group of people, for instance, right now we're working on Healthy PA. And so that has taken the priority. We're working on the reforms to the current Medicaid benefits. So when we're done with that, which we're hoping won't take too long, I mean, we are working day and night on getting that done. Then the next step, asset test will probably be one of the very next ones. We started looking at it, but then we got sidetracked because we have to do Medicaid
Corbett doesn't
reform.
want to change it.
Huh?
Because Corbett doesn't want to change it.
No, that's not true. He wants us to look, he has said to us that we are to look at everything. Every piece of what we've done. That's good government. Good government is not just to sit back and say, oh, well, we've always done it like this, we're just gonna leave it. It's time we take a look at it. There's data available that will help us to see, did we make the right decision, did we not? Are there groups we should change it? I don't know if you're aware, but there was the asset test before this administration was extremely, it was much lower than the one we currently have. Then it went away, now it came back at a different rate. Well, what's right? And that's our responsibility too. Well, our responsibility is to know that, and we don't know it, we're having all the data pulled, but again, right now, today, We're looking at the reform for Medicaid and Healthy PA, because, and ensuring that everybody has insurance like your children. And so those are the critical issues. They're all critical issues. There are so many critical issues. And we're just doing what we can in a fashion that we can handle it.
So we have also been circulating a petition, and we have some copies here for you, and I'll just read real quick what the petition says. Dear Beverly Maverick, Secretary of the Department of Public Welfare for Commonwealth of Pennsylvania. Pennsylvania currently ranks as one of the worst states in the nation for low food stamp processing rates. For this reason, the United States Department of Agriculture, which administers the SNAP food stamp program, has required the state to take corrective action. Having encountered poor customer service at the Department of Public Welfare and/or having learned from Just Harvest's research that such problems are systemic, we support the following demands to improve the treatment of Pennsylvania residents seeking assistance from the department and to address chronic problems in administering food stamp, cash assistance, and other public benefits in a timely, efficient, and respectful manner. And then the list of demands up here, which we will go through one by one and allow you to address. Real quick, Ms. Gordon.
I'd like to say, Just Harvest is one of the agencies in Allegheny County that deals with problems that all of our citizens are having. And you'd be surprised, other agencies that deals with the same thing you deal with or more. One of the things I like for the secretary to deal with is when a mother, I deal with food stamps a lot. When a mother calls me and says, and I visit the welfare office a lot, walks in and says, I want to see my worker. And because that mother has been in that office dealing with food stamps 3 times, sometimes 4, the workers will not see them because they do not have an appointment. And these are young women that's working, that taking time off from their job to come and find out what's going on when they have been sending their new papers to be redetermined. Is there any way that we can deal with this? Maybe we need to get in contact with Patty. Maybe she can make an appointment to sit down and talk with us about this.
I think you should. I think you all, I think it would be a really good idea for you all to reach out to the managers of each of the centers. Have they ever heard a meeting like this? Have they had the opportunity in Allegheny County to sit there and listen? With this group and consumers.
No, not at all, but that's something that we can definitely,
We have invited consumers at different times.
yeah.
Because I think it's
intimidating for the consumer to go to things like that. I can tell you that they're all scared.
Oh, don't be scared. But how do you know, I mean, it's one thing to hear it from the advocates. But when you look at people's faces and you're hearing this, it makes a difference. So they need to hear it because much of what we're talking about, I know some of it is systemic, I get that. Some of it is also cultural. It's based on the fact that you have offices who tend to believe the worst of people sometimes, or that everybody doesn't want to work, or everybody's here just to get what they can get. And that's not true, but until you meet the people that are impacted, sometimes you don't know that. And the way they meet them.
Every CAO director is in an office where they could do that any day of the week in the waiting room.
Oh, I
It
know.
should not be incumbent upon Just Harvest to organize a meeting where clients can sit down with the CAO director to hear what's going on in their own office.
Right.
And
I agree with that.
We have met repeatedly, over and over again, on a quarterly basis for years now, with Patty and other executive staff of the county assistant's office, discussing these issues over and over and over again. And the reason that we'd ask you to be here today is to understand from Harrisburg and to send that message from the top down, the same message we've been sending from the bottom up.
Got it, I get that.
That the attention of those offices to the people who are walking in the door for service is totally inadequate. And they're rude. I mean, some of the workers are rude. They're like, well, why are you here?
hard to get a job. We're all.
At DPW, we are all state employees. We are all paid by taxpayer dollars. We are all considered public servants. That means we have, if you're taking a job like that, your responsibility is to be responsive to the public. There is no excuse. You don't have to, there's no excuse. It doesn't matter. You shouldn't have to say, I have a master's degree and so I'm in this, you should never have to say that. That doesn't enter in. They are to treat everybody with the respect that they would like to be treated with.
You should send ringers to the offices and have people apply and see how they treat them.
I did. We've done that.
Okay,
And
I
we're
know there's a
looking.
couple other
We're
comments,
looking.
but we want to get through, our recommendations. That was one of the main reasons why we asked you.
Sure,
We
absolutely.
brainstormed and we come, consumers, Just Harvest, other ad agencies, we've all sort of come up with some suggestions and recommendations. And you had a chance to look at them.
Yes, I did look at it.
So the first one we want to talk about is the phone system, which we've talked a lot
Right.
about today. So we're asking that you revamp, we understand you, in your opening statement, you mentioned that there's cost involved in that. But there has to be some kind of way to stop drop calls at the change center, to stop drop calls and disconnects at the county assistance offices, and to put functioning phone numbers that are answered by human beings on all notices. This is something we've repeatedly talked to our executive director here, that can you please put a working number on the notices so that when people call it, it doesn't just ring. It serves no purpose to put a number on a notice that no one can reach anyone. And so, which as Ken stated, the reason why we invited you here is we have been having these conversations with Patty and before her, the executive director prior to her. So these are conversations we've been having for quite some time. And it's not a lot to ask. I mean, isn't that what the number is supposed to be there for? So you can actually call and talk to someone?
Yeah.
So, I don't know what that takes, you know what I mean? If it's making, revising the notices and making sure there's a working number. You can call anyone nowadays. I mean, I know a lot of times I call my water company and they say, you're 24 in the queue. If you can't hold, leave your name and number, we'll call you back. How hard is that to do something like that with the customer change center where, you're 199 in the queue. You can't wait 2 hours, leave your name and your number and we will call you back. I mean, that's not a hard fix and I think that would alleviate a lot of folks' frustration if they leave their information and have confidence that somebody's gonna call them back. So address their concern or answer their question. Second one, we asked to increase voicemail capacity on caseworkers' phones. This is an issue that Just Harvest worked on a long time ago before we even had voicemail. We had Deputy Secretary Sherry Heller come in. And we asked them, because at the time, before we had voicemail, what was happening was you got busy sitting bang, 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 bang all day long. And so we knew there was a pilot project in one of the offices in Allegheny County that was actually using voicemail. So we asked to have voicemail put in all of our county assistance offices. We actually worked with her for a whole year with budget issues and contract negotiations, and we got it done. At the end of that year, all the county assistance offices in Allegheny County had voicemail. So we were excited about that. Now that we have voicemail, nobody can leave a voicemail. Or nobody calls you back. So we haven't yet arrived at a viable solution. So now we do need to, and then the capacity was increased, then it was decreased, and actually I'm not even sure where it's at right now because you guys just got a whole new system. So I don't even know. From what I hear in one of the offices, the caseworkers don't even have
There's rumors
voicemail.
that they may be doing away with the voicemails altogether for the consolidated offices that are moving to Pines Place in Allegheny County, which is three river, not three rivers, Liberty, Southeast, and Southern. No, Southern, Liberty, and one other office, I'm not sure. They're consolidating those offices at Pines, and nobody has voicemail right now for Three Rivers at all. And there's nothing in the works for them to get voicemail.
So we'll have to, we definitely need to.
No voicemail?
Yeah.
No voicemail at all for Three Rivers.
We don't know if that's temporary or permanent, but we need to figure it
Rumor
out.
is it's permanent.
Well, that's what it's rumor, so we need to.
With the new phone system, the way that it's set up, it's my understanding, and I sent an email and was trying to get a response back, but didn't get one yet, that it's actually one large email voicemail box that will then be given to because it goes to our computers and then we can listen to the voicemail through our computers. It's the whole high-tech thing. So those large email box, so it's not like I personally will have a personal voicemail box, it would then be emailed to my computer and then I can listen to it through that. So that might be what they're referring to, that they won't have their own voicemail box that they go into.
So we need to hear more about
No.
that, yeah, definitely.
And there are, because of the consolidation right now, there are issues with the funds.
Right, that's what you did send us that.
Yes.
We had asked that when we saw it on there. They make it sound like it's temporary, but we'll check.
Okay. So our third ask is to send out computer-generated notices to consumers to confirm their verification documents have been received and alert them to what documents are still needed. Because you've heard here several times, people send things 2, 3 times, and they never know where the documents are. Have they been received? Do they have them when you call? Obviously, you can't get anyone on the phone. So you're worried. This is personal, confidential information that people are sending in the mail, and they don't know where it's ending up. So if there is some kind of way that there's a computer-generated notice where a caseworker puts in documents received, clicks on something, and it spits out a notice to Rochelle that says, we received your documents, there are still some outstanding information we need, something at least, because you can't get through to anyone. So you're waiting, and you're waiting, and you're waiting, you're like, I don't know if they got it, I don't know what's going on. So some accountability on the caseworker part.
And I will tell you, we actually are able to send out notifications right now via email. Very, very, very few people in the state of Pennsylvania have signed up for the ability to do that. And once they sign up for that ability, we can send things electronically. I don't know that we can have an automated thing because it'll probably cost us hundreds of millions of dollars to do that. But we could probably work out something, when it comes to email technology. But just so you guys know, please sign up for email notifications because then we would be able to do that electronically through your MyCompass account. But it's a shockingly low number of people in Pennsylvania who have signed up for that.
Maybe they don't have computers.
Exactly.
And that's true, but there, there's people that, but this wouldn't help then if you don't have email. We wouldn't be able to email you. So.
Well, no, we want, not electronic, but we're saying it's computer generated, meaning that a caseworker doesn't have to go in and type something for me, that it's an automated notice that if she just clicks on something, then the computer automatically, right, so that, it doesn't put more work on the caseworker, but it alleviates the consumer's concern about did they get my.
Did they get it?
Right, exactly, yeah. Sort of like receipt.
Got it.
You know what I mean? It's
That's really what it is,
Yeah.
receipt or.
Fourth one, when consumers deliver documents in person at a CAO, staff should scan verification documents on site immediately and give receipt to consumers. We have had a lot of consumers complaining that they're not able to get receipts. They are told to leave their documents in the Dropbox, and then the same thing happens. They physically go all the way to a CAO, leave their documents, and then weeks later they're told, we don't have your documents. So if they're scanned into the system and they're given receipts, then they know it's been received, it's been scanned, and they can even give them back their originals. You know what I mean? And so this whole self-service thing is not working out too well. Because it's technology. A lot of people are not tech-friendly and don't really, you know what I mean? So
Right.
it sounds, in theory, it sounds good, but in practice, it's our experience that it's not working out at all. Caseworkers, number 5, caseworkers must treat all consumers with dignity and respect. And you said that we illustrated today several examples of how that's not being implemented. Consumers should have access to surveys, customer service surveys, and just pharmacy public should have access to those survey results. So in all of Allegheny County Police offices, there's supposed to be a place for this customer service survey. You need to fill it out, do it anonymously, and put your identifying information on it. A lot of people don't know that that's there. It's not really visible. Some places it's right in the receptionist desk, other places you don't know where it is. And so we think that more people should know that that's there. Because I think it helps you in terms of the service that you deliver. A lot, I mean, every time I call Comcast, they're like, at the end of this call, we'd like you to answer. And I'm like, no, how many times I tell you I don't want to do that? But everybody's doing that. It's about quality customer service. And so you need that feedback. So we think that should be in a more visible place, that the results of those surveys should be available to the public so that everyone, consumers, agencies, as well as the department, can see where you are with good customer service. And so we talked to our executive, director here about that many times, and, we get, it's there, it's in the office, but it's not visible. There's no sign that says customer service, there's nothing that welcomes people that says, we want your feedback, tell us how your service was today, nothing. And so we think that that needs to be in place. Number 5, the data should be transparent. So we always try to find out, especially since Modern Office was implemented and customer service center was created, how many calls are actually being logged, on a monthly basis? What are the hold times? full frequency. You know, people call at 8 o'clock in the morning, the voicemail's already full. They call back at 11, voicemail's full. I mean, all day, this is what you're getting. So knowing the frequency of that would help. And I think it helps people understand too. If people know that the capacity is only 9 voicemail messages, and people have a little bit of understanding that, okay, well, now I see why it's always full. But if that information is not transparent and made publicly available, people don't know what's going on. And it looks like you're hiding something, or you're just being intentionally incompetent. You know what I mean? And so having that information transparent, I think, will ease everybody's concern. And number 6, of course, what we've been saying is, I'm sure you hear this all the time, and every discussion we go to, we need one basic worker. We know that that's a budget issue. You know, you don't have the total, control over that and how that goes. So we would ask that you would be a champion for us when you're preparing your proposal to give to the governor, and to, I mean, it doesn't hurt to ask. That's what I've always been saying. You think it's a no or yes. There's no harm in asking. So
We just asked for this year 200 more, or last year, I guess, last year's budget, and we will be putting in for additional ones again. Okay. So we already.
200,000 or 200 people?
200
People.
caseworkers.
Caseworkers.
200 more caseworkers.
For the CAOs. And even with all the. Recognize that. It's not taking a case for them, you can spit out receipts and do different things. I would tell you we're working towards all of it. That's not a good enough answer. And I'm not saying it is, I know that, it's not a good enough answer. We're gonna go back, we have to have the discussion with, the people in the Bureau. I'm glad I'm here today because I needed to hear it. So thank you all, for that. We're just gonna try, continue to move forward.
So
And do our
can we
best.
follow up with you?
You can follow back. I see Miss Dorothy all the time.
Well, you'll see me next Monday. Well, I'm gonna be down.
I'm supposed to say that. Yes. No, I mean, yes, absolutely you can. I need to have our deputy secretary hear what you have to say. I need Tom Strickler, who's our new guy who's really he is trying. He's looking at everyone. We have 67 counties, which means 67 offices, and all of them have,
93 offices.
we have 93 offices, sorry, I forgot about all the ones in Philly and there's more here. So we have 93 offices, and, for every one you feel like you're moving forward, then something else comes up. Some of the problems clearly are systemic across the board, no question. It's not just Allegheny, it's not just Philly, it's everywhere. And we've been pulling the data, we've been reviewing the data, we've been looking at what's happening, the data that you were talking about, so that we can make informed decisions, but this is hard. And what I can promise you is that I'm not putting my notepad away, I'm gonna take it with me and hold on to it and have the conversations.
I wonder if you could just one more time state what the priorities are in terms of the different issues for you, in terms of your working on these? Because I think you sort of said you had certain priorities, but I didn't quite get it.
Are you talking, you mean, when you all were talking about the asset tests and some of the other things?
About all these issues that we raised.
Efficiency and things like that.
The issues that we raised.
My back to basics, communication and accountability?
Yeah.
Back to basics really means that every bureau is to go back and look at what is our responsibility, what are we supposed to be doing? I'll give you a great example, what you all talked about today, that's basic. That's basic responsibility for the Department of Public Welfare. We're supposed to be answering the phone, we're supposed to be ensuring that we don't lose paperwork, we're supposed to
Yeah,
be
that's
making sure
basic.
those are basics.
Yeah, basic.
Yeah, they are.
So
So
that's
that's
a
our first priority, is to focus on back to basics, communication, listening, I mean, both ways, internal, external, hearing what you have to say and then doing something with it. And the last one is accountability. And again, accountability to consumers, so the people that we serve, but also to the taxpayers. So, you know, from both perspectives. So everything that we've talked about to here is really our priority.
So I know these folks have worked with us really hard on coming up with these recommendations, and so, if it is, you know, possible, maybe, I wouldn't ask you to come back to Pittsburgh, but if maybe we could set up a conference call in a couple of months where we could sort of just.
Yeah, and I'll be back in Pittsburgh, so.
Or maybe every,
Yeah.
you can come back to visit us, but we,
Yeah.
you know, wanna follow up and sort of get
Absolutely.
an update on where we are on some of these things, and see, you know, if we're making progress.
You got it.
So, I'll work with Michelle, maybe. we
You
can
got
set
it,
that up.
anytime. Thank you all.
Thank you for coming.
Thank you.
Thank you for
And,
coming.
and you all, thank you for being brave and talking. Don't ever be afraid. You don't have to be afraid, okay? So thank you.